Hey everyone, happy Tuesday. Hope you're doing well. I first wanted to start by thanking you guys for your positive messages and feedback. I really appreciate it. These videos are really a way for me to connect with you guys through something that I'm really passionate about, which is mental health. So you guys listening and watching them mean the world to me. So I wanted to thank you. Today I want to speak about anxiety. Occasional anxiety is normal and is okay. And chances are you have felt anxious in the past or maybe feeling anxious currently due to this uncertain situation with COVID. So it is normal. But what I am going to be speaking about is anxiety disorders, which are a group of illnesses that cause constant anxiety and worry and fear and keep you from doing your everyday chores, everyday life, everyday tasks, and keep you from living the life that you want and desire. I thought I would go over the most basic and common types of anxiety. I'm going to start with generalized anxiety disorder, which is basically a excessive feeling of fear, anxiety, and unrealistic tension and worry. So that is generalized anxiety disorder. Chances are if you have it, you know exactly what I'm talking about. Okay, next we have panic disorder, which is a sudden intense fear that brings upon a panic attack and is usually accompanied with physical symptoms such as excessive sweating, heart palpitations, chest pain, and a feeling like you can't breathe. It is very important that you get these symptoms checked out and make sure that it is not a physical illness and to rule out anything other than a panic disorder. Okay, then we have social anxiety disorder, otherwise known as social phobia, which is a constant feeling of self-consciousness, feeling like when you are entering a room, everybody's looking at you, judging you. And this feeling is overwhelming to the point where a person suffering from social phobia may prefer to stay home and sit out the event because the feeling of constant judgment and self-consciousness is just so much to bear. I am a big fan of treating anxiety with cognitive behavioral therapy because the therapist can really combat the negative thinking and the negative patterns by introducing rational beliefs and rational ways of thinking positively. And I think that it is something that really helps those that suffer from anxiety. Okay, so let's say you recognize that you're experiencing an overwhelming amount of anxiety. What can you do other than going to the doctor and seeking therapy? I think first and foremost is to understand your disorder or your anxiety level. And I know you guys are going to say, I've already told you this, but journaling is one of the best ways to understanding what triggers you, what creates a feeling of anxiety for you. So understanding your anxiety is one of the most important things. Journal, I think you will not regret it. Okay, this one is a really important one, and it is to stick to your plan, stick to your treatment plan. Often the psychiatrists give a medication and the person takes it for 2 weeks and they stop. And I think it's because a lot of people don't see results. It's important to know a lot of these medications take 6 to 8 weeks to really kick in, and 3 to 6 months for you guys to see really, really good results and benefits. So it's important to stick it out because the symptoms will decline. You will feel better. It's just important to really stick to it, even if you don't feel anything in the beginning. Your treatment plan is to see a therapist. It's important to stay ahead of it and to continue seeing your therapist once a week. I know a lot of us therapists are doing virtual work, which is wonderful because it's even easier for you guys. No drive, no getting in your car, no getting ready. You just hop on a call and someone can help you. So it's the best time to seek therapy right now. And it can be really helpful for you, especially if you ask for cognitive behavioral therapy, in my perspective. But of course, therapists all have different theories they practice. Another important part of treatment for anxiety is to keep caffeine levels very low, alcohol level very low. Occasional glass of wine here or there is okay, but really anything more than that can cause a lot of anxiety if you're already feeling anxious. And if you're already having these symptoms, it can trigger you to feel more and more anxious. Aerobic exercises such as running, biking, these are all really good. They change your brain chemistry and really help you feel better. So this is pretty much what I had to say. I always say journaling helps. So I want to end it by saying I I think you guys should journal if you're feeling anxious. Keeping track of your symptoms is really important. And I think last but not least, I want to finish by saying having a really good social group or a support group is really important. So if you don't feel like you have that in your friends, there's many different support groups there for anxiety. I will try to link them in my story so that you guys know where you can head to for some support. Sending you a lot of love. Thank you again for listening to me, and happy Tuesday.